Thank you for coming back again. It's your girl Miriam Bugomba, and today I want us to discuss about the sexual transmitted infections and the way they are transmitted and how they should be controlled and the signs and symptoms, because the STDIs have been a common challenge to many youths in the campuses and universities, colleges, in high school, maybe all those. Many teenagers face these challenges. These sexual transmitted infection are infections that are transmitted through sexual intercourse. They can be transmitted sexually can be transmitted sexually, can be transmitted orally, in through the anal, orally, or through the sexual intercourse. Also, these diseases can be transmitted by non-sexual means. They can be transmitted also through non-sexual means. So these diseases are like, examples of these diseases are syphilis, gonorrhea, HIV and AIDS is one of them. We have the diseases are syphilis, gonorrhea, hepatitis, HIV. They can be transmitted. So in most teenagers, the disease is transmitted in many ways. And these diseases can be transmitted because of the following factors. Number one, conflict and poverty. Because of poverty, many girls engage themselves in sexual intercourse so that they can be paid. Maybe they are selling their body so that they can earn a living, waishi vizuri, at least earning a living so that they can live, and to earn a living so that they can have something on table, something that they can take. They depend on selling their bodies. This poverty also make many ladies wanakubali tu, hata kama ni ugonjwa nipe, bora pesa, which is not a good thing. Another thing that causes the transmission of the sexual transmitted diseases is multi-partners. You have many partners, like hauna moja na uwezi abstain, so uko na wengi, like a lady having many partners ama a man having many partners. This will lead into the transmission of the STDs. Another thing that causes this is the environment, the peer pressure. Maybe wewe na rafiki yako, because your friend is doing something, you decide doing it. Sasa kudecide kufanya hiyo kitu iwe inafanya ukue na nini, you get that disease. Maybe unaona rafiki yangu, maybe mimi dem, naona rafiki yangu akiuza mwili yake ana earn, na mimi pia nasema si rafiki yangu anauza mwili na ana earn, kwani mimi mbona nikae tu? Let me also go sell my body to get some cash, at least nikuwe na food on table. With this economy, somebody just decide, let me just go and do it, then I come with some cash yenye at least neza kuwa na food on the table. Another thing is poor usage of condom. Like teenagers don't know how to use the condoms. They don't know how to use the condoms. So when they don't know how to use this, wanazitumia vibaya. Then maybe wanadhani wametumia the condoms, they will protect them from having the disease, lakini juu wamezitumia vibaya, cause them wana contract the disease. The poor usage of condom. Amejamba, mimi si nilienda kwa ile jamaa, hata kama alikuwa na ugonjwa si nilitumia condoms. Kumbe hizo condoms zenyewe, they never use them in a good manner. Meaning when you use wrongly, you will obviously get the infection. Another thing is the practice of unprotected sex. The practice of unprotected sex. Wewe umeenda kwa jamaa, umejiachilia tu, then anakupatia ugonjwa. Another case inaweza kuwa mtu amerape, like a lady is being raped. Akiwa raped, mwanaume akimtumia, that's the sexual intercourse, hatumii the protective germs that is using, like use of condoms. Hataki kujua ye, so long as ajitosheleshe. What he wants is what he wants. Hataki kucare about what will happen next. Pia inaweza kuwa the use of the illegal substances, like abusing of alcohol. Mtu anaweza kuwa anakunywa pombe, akisha kunywa pombe anasema unajua pombe ilinifanya nikafanya sijui nini, ama umelewa, then somebody takes advantage of you. Sasa kama umeenda party for example, then wewe haujai kunywa pombe, but you go there, take your drugs, unakunywa, like unakunywa tu, like unakunywanga normally, then after taking the drugs haujielewi, watu wako hapo ni mafisi, they take and have use of you, then you'll contract the disease obviously. Juu hata akili zao itamwambia wafikirie kutumia the protective method when having that sex. Another thing that we are going to talk about is another thing that we're going to talk about is the signs and symptoms of this disease. We start with the Symbolism. When somebody is seen to have like wakati utakapojua you have that Symbolism, utakuwa na some signs and symptoms. Number one, you will have high fever. Utakuwa nasikia joto, baridi nini, yani haujui uko na fever. That's a sign of it. Another sign of it, utakuwa na swollen ama itching. Utakuwa unajisikia kujikuna na pia unafura at the private parts. Unafura, unasikia kujikuna, you have that discomfort, then hautakuwa comfortable at all. Pia unaweza kuwa na utakuwa reddish uko chini, in your private part itakuwa reddish, na pia mwili yote inaweza kuwa reddish, kuna kujikuna, unaweza kuwa na itch mwili yote na una turn reddish ama reddish ama reddish brown, like ngozi yako inatana, unasikia kujikuna kuna. Alafu hii nini pia inafanya ukue na sores, ukue na vidonda, unaweza kuwa na vidonda. Alafu a long prolonged series yenye haujaenda hospitali kutibiwa inaweza cause memory loss, inaweza cause blindness ama ukue paralyzed. Maybe unaweza kuwa paralyzed at one side ukienda hivyo chini. So the best thing is we take risk as early as possible, ndo isi lead into that when akili yako irukwe, you have mental disturbance, you'll be a problem to the family. So as early as you realize you have these symptoms, just go and visit a medical personnel ama your physician, just somebody you trust, any doctor that you trust. Unaweza share na hiyo nini, unaweza share. But if you have a close friend you can share with na kusaidia connect to getting a doctor, please do so for your benefit. Another disease that we're going to look upon is gonorrhea. We're going to look about the signs and symptoms of gonorrhea. Gonorrhea unaweza kuwa na thick and cloudy discharge. Itakuwa thick, cloudy na bloody discharge in both ladies and men. Like discharge ni uchafu unatoa at the private part, inatoka ikiwa cloudy, alafu iko na some spots of blood in it. Alafu in ladies utakuwa na prolonged menstruation ama very heavy one, ama unamaliza kunyesha, umemaliza tu, unajua mimi umemaliza kunyesha, lakini bado unaona some spots of blood, which is not a good thing. Another thing is the itching. You will be feeling itching at the anal part ama private part. Huko at the private part utakuwa na feel kujikuna kuna, of which is not a good thing. Wakati umeona any of these symptoms, just rush to the hospital so that you can get treatment as early as possible. Another disease that you're going to look upon is trichomoniasis. I don't know if the spelling are very correct, but I hope it's at home. The point is at home. And if you know the correct spelling of it, ama venye inatamkwa, please, you can help me at least know it. It's very difficult for me to say it, but don't mind. I hope you get it clearly. Then trichomoniasis, it has its signs and symptoms. Sign number 1, utakuwa na some clear white greenish discharge, greenish yellowish discharge. Unaona itakuwa greenish, yani maybe ikuwe greenish, ikuwe yellowish, ikuwe whitish discharge, alafu for both vaginal and penis. So the discharge will be coming. That's number 1 sign of it. Another sign, when you are urinating, you'll have a painful urination, and like when you are urinating, you'll be feeling pain. Unasikia uchungu when you are going for your short calls. You'll be feeling pain. Another thing, pain during sexual intercourse. So this is when during the sexual intercourse, you feel pain. It occurs mostly in ladies. Wana feel hiyo pain sana kuliko in men. Yani wana feel. Alafu in ladies, they have a strong vaginal odor. In ladies, that one occurs mostly in ladies. Another thing, you'll be feeling an itching at your private parts. Itching will be highly at your private parts. The last disease we're going to look at this time is chlamydia. Not so. How is the spelling? CHLAMYDIE. Help me spell it. Help me. Pronunciation of it. Help me. The pronunciation, please. I'm not very good in pronunciation, so please help me. The number 1 sign is painful urination. When you are urinating, you feel pain while urinating. Another thing, you'll be having lower abdominal pains, like tumbo inakuumia huku chini. Nasema you're telling your friend, huku chini bana, naumia tumbo na huku chini tu. That is another sign. Another sign that occurs in ladies is bleeding in between your periods. Bleeding in between your periods. It occurs like maybe umaliza your periods, then you're still seeing some spots of blood. That is another sign of it. The last one is painful during sexual intercourse. When you're having the intercourse, you feel pain. It occurs mostly in ladies. Wanna feel pain sana as compared to men. Another thing that you're going to look up about is how to prevent the sexual transmitted infection in colleges and universities. How to reduce cases of it. They are very high. I know you have a friend, you have even your sister, your brother, your friend, your relative, anyone in you know about, maybe I've ever had this, ama unajua konayo at this particular moment, ama we mwenyewe uko nayo. So these are ways on how we should prevent hizi cases zisiendelee sana. So number one of this is educating. You educate the teenagers about it. Yani unafunza tu about there are these and these diseases, so if you don't want to contract them, haufai kufanya hii na haufai kufanya hii. Another thing that you should be doing it is guidance and counseling. Teachers should guide and counsel the teenagers like continuously, bila kuchoka. Hata wakishow wana interest, you continue showing them, unawafunza, unawaambia you should be doing this, you should be doing this, so that wakuwe na that knowledge about it. Another thing is vaccination. Vaccination ni like there is a time unasikia it's a cervical cancer month, unaambiwa you go for vaccines, cervical cancer vaccines, and you could prevent from you having the cervical cancer. So something of the sort, we do the vaccinations as directed by a physician or a doctor. Alafu you should educate on how to play safe sex to teenagers. Unawaelezea if you don't want this na uwezi abstain, unafaa kutumia nini during your sex intercourse. Unafaa kuwafunza, unawaambia juu uwezi abstain, we mwili yako inakwambia you are very high, you cannot even abstain. So what should you be doing and how should you be playing it, so that you avoid the transmission. Transmission is very high, mostly in campus. It's very, 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 very high. Another thing you should be doing, advise the youth effect of drug abuse. Juu hizi drug abuse zina lead pia, zina contribute for the transmission. Maybe mtu amelewa, then mtu anamchukua tu without a knowledge, anambeba tu, anashanga wewe ukimaliza, come back into your senses, ndio Rahada, what happened to me? Ukiuliza mwenye kando yako anakuambia nothing happened. So you should educate the youth on the effect of taking drug or abusing drugs. You should teach them very well so that they can understand them well. Lastly, you should always advise the teenagers, like have a continuous talking process. Muongee tena, ongea, create your time. Maybe if you are a parent, create time for your kid. Mkae chini, akwambie mimi niko na hii shida, niko na hii, alafu advice venye anafaa kuisolve nini. Alafu pia these diseases zinatokanga in the toilets. So as teenagers, or you as a parent, you should teach your teenager on how to use the toilet very good, like watumie vizuri. Unaelewa, somebody is going to the loo, anakaa tu chini, hajui the hygiene there. So you should teach them on how to keep the hygiene, on how to use the toilets properly, so that they avoid this. You may also contract them from the toilet. And a disease like syphilis inaingia hata through the ngozi. So wakati wanaenda loo, wana make sure when they are doing responding to their calls, they do it in a good manner, na wana avoid hizo maji kwa splashia in ladies, all those in men. Hata kwa ngozi, umesikia syphilis huwa inaingia hata through the ngozi anywhere. So we should make sure that to take care of this. Anyway guys, thank you. Please share with your friend, share with a friend, share with their family friends, relatives, your brother and sister about the diseases. And in case you have any symptom, don't hesitate to go and see a doctor. Please go see your doctor and get treatment. Don't fear of you sharing to the doctor about what you're feeling, about how you've been suffering. Just share, then you'll get help. Please subscribe, like and share. Bye bye till next time. Love you.